and then people will be hopefully coming in as we speak. So this is the room number 1. It's the breakout room where we focus on digitalization, communications, and Internet of Things. We have altogether 7 presenters in this session, and we will have a 3-minute presentation from each. They will be sharing their screen, and then we will, of course, also take questions towards the end. So please feel free to ask your questions as we go, and we'll try to we will take them towards the end. So without further ado, I think we'll allow the first company to present. That would be David from Crayon. So David, if you take control and share your slides, please, and get going.
All right, thank you very much. Let's see here. I hope everyone can hear me and see me. So since we just did the first minute one, let me just actually jump down to the examples of what we actually do. Some examples where we have helped companies is to basically do heart condition diagnosis through machine learning, skin type classifications and recommendation services through image recognition, and also privacy protection for data collection. We are also at the moment responsible for delivering the entire IT infrastructure to the Norwegian healthcare system for the next 3 years. And we are a member of APAC Med as their first and only machine learning and AI subject matter expert member. So we are quite excited to collaborate with global organizations to see where we can support with our expertise. Some of the things that we have done include identifying polyp types from colonoscopy to reduce the time where it takes to initiate the correct treatments process earlier. So in real time, we're able to identify if a polyp is malignant or not. Another example is to prevent patients falling out of the hospital beds using 3D cameras to make sure that whenever patients wake up from operations, for example, and they feel a bit disoriented, they are not falling out of the bed trying to get up. So we utilize deep learning to identify the limbs and behavior and alert nurses that are close in proximity to quickly interfere if necessary, or intervene, sorry. And then finally, a email routing system which utilizes a quite highly complex routing of email queries using natural language processing. So we call this model DATE, and it is able to quickly and accurately classify content in emails and route to the right subject matter experts. And we basically has been able to help this company to guarantee a 4-hour response time and to reroute 82% of their emails automatically, saving a significant amount of man hours. So with that very short time, I look forward to hopefully discuss in other opportunities with whoever found this interesting, because we have a lot more to share. So thank you very much.
Thank you so much, David. We will, in quick succession, switch then over to Christian Vanberg from Dossier Solutions. So if you take control of the screen, please. There you go.
So here we go again. So in Dossier, we do health system competency management. And what this means is that you have in a hospital or in a health system, you have a lot of very competent people, like the nurses in the A&E. They have to meet a lot of competency requirements, more than 100 to be exact. A lot of them relating to technical equipment and or to software maybe. And a lot of them requiring recertification. Typically, these requirements are not e-learning. There are a lot of other things. It's side-by-side learning, it's the use of resources, it's procedure guides, simulation exercises, instructions for use, external training, e-learning, for example, and a very small amount is internal e-learning. So health systems typically don't have a system to manage this other than Excel or paper still, which is quite shocking. Obviously, if you take a bigger view and you look at the point of view of a team leader with 50 employees, it gets complicated to manage all of this. Take the health system view with several tens of thousands of employees, it can get very difficult. So what we do is we offer one hub for all learning, where we manage all competency requirements across all types of learning. Also with a view of, I mean, we have other vendors in the room here now as well. A lot of the time when you implement a new solution, you'll find that there's a component of competency requirements in that. So if there's something along those lines that you'd like to discuss with us, we're open-minded about that as well. For the health systems, what we offer is operational excellence and patient safety, knowing that every employee knows what they're supposed to know at the point of work at all times. This is also important. It provides the data necessary for effective reskilling, reallocation, and ramp up, and the data you need for shift and workforce planning and privileging, access control, and so on. I think that's pretty much 3 minutes.
You're actually in good time, so thanks a lot for that, Christian. Not bad at all. Getting pretty good at this towards the end of the week. All right, so the next company up is Quuppa, and it's it's Dan from Imatis, and after that we will have Sami from Quuppa. So Dan, please, if you take control of the screen.
Right. Right. Hi, everyone. My name's Dan from Imatis in the Sydney office. Like I mentioned, we opened an office in Singapore recently. We're a company which specializes in integrating into all the what we call heavyweight systems in the existing healthcare industry right now today. We take that information, the real-time data, and port it into mobile portals that serve to facilitate the patient flow throughout the hospital, the primary care, or the polyclinic environments. As I mentioned, our software integrates with the heavyweight systems. This includes the electronic health records, such as the one that's being implemented across Singapore right now, and other facilities management, building management systems, so that people in their role in the patient flow can control these various systems without having to access the systems themselves. This is a picture of an example of an over-reliance on what we call heavyweight IT systems, where each of the pathology, the imaging, the patient records, the Active Directory, who's on staff, paging, each one of these systems has its own separate terminal. The alternative we present is to integrate with these basic systems and lift the data up so that we have a flexible role-based portal wherever it is needed along the patient journey. In a mobile device along the bedside, here are the lab test results, medical notes, Active Directory integration, the nurse call integration, the PAS, for example, and who's on shift. This propagates across the hospital into the various wards, and we can aggregate this information. So the best thing about our flexible lightweight IT is that we train our customers how to reconfigure these portals on their own without calling us. We can talk about that in the future. Thank you.
Thank you so much, Dan. You're all doing very well for time. So I think we can switch then over to the next speaker, which will be Sami from Quuppa, as previously announced.
Yes, let me just switch to the right place. Yes. So I'm Sami from Quuppa, this time calling you from Dubai. I'm usually based in Helsinki, but traveling a lot in Singapore and the region. We are offering together with our medical partners a solution for hospitals where we focus on saving lives with enforcing the hand hygiene and faster care, equipment tracking, people tracking, patient tracking, and then improving the operational efficiency with business rule engines and doing all kinds of patient flow related things. We can also monitor the contractors, how well they clean the places and so on. And then of course all this adds to the reducing of costs. We can monitor the crash cart inventories automatically, do asset management and so on. And then of course our technology is also used in increasing the security and safety of the patients and also the personnel of the hospital. We can raise an alarm with a 10 centimeter accuracy based on where the people are, if they are in the wrong place, wrong time, and integrate that into building management. And then we can enhance the user experience for anybody outsider coming into the hospital, be it visitors, contractors, cleaners, and so on. And now in COVID-19 situation, we are focusing on hand hygiene, reinforcing as we can control also how well that is used. And also the contact tracing for infection tracing purposes. We can do that in real time, and then also backwards we can check that who was in interaction with whom. This is basically the use case side of our technology, and then a little bit about our partner solution. So the Emphatic Building application built by our partner is basically a digital twin of the whole building, and then it makes it possible to visualize anything that happens in the hospital. So all the hospital staff can from their phones or tablets automatically or bigger screens see who is where the patients are flowing and what happens inside the building, and they can see the room occupancy as well, and as well as where the machines are, where the wheelchair is, and so on. And our partner Imatis Innovation in Singapore are the one-stop shop for this full solution. And there is, for example, reference case now in Norway for Narvik Hospital, and there's another over 190 square meter hospital being built as we speak. It's going to be ready next week, and so on. So the Emphatic Building has quite a lot of references in Europe, and now we are expanding to your market together with our local partner Imatis Innovation. Something about our technology, so it's accurate down to 10 centimeter level. We are using a unique method over Bluetooth, which is direction finding, and it's versatile. So basically we can track any Bluetooth device, tags, badges, wristbands, mobile phones, tablets, and so on. And it's infinitely scalable, so we can also implement campus size implementation, even city size implementation, and it's open, so we have open interface, so you can integrate it into pretty much everything. Okay, I think I reached my time. Thank you.
That's it, Sami. Thanks a lot for that presentation. We then switch over to Kari from Secapp.
Yeah, good afternoon from my side as well. So let me get my screen shared as well. Let's get started. Yeah, I'm the CEO and co-founder of Secapp, and in short, what Secapp does, it is built for critical communications and alerting, and especially with the focus of helping to save lives and manage different crises with ease. Currently, Secapp has already helped different ministries of health, hospitals, ambulance services, and volunteer services in Europe and Middle East to respond to different emergencies. And the goal of that, of course, is to help to save lives, and moreover, in the daily scope, to keep their daily communications secure. Secapp is already being used by over 83,000 professional users, and of course, now we are striving to make an impact in Singapore. The big picture behind Secapp is that when we are facing these emergencies, disasters, or infrastructure or device failures, it means that we need to be able to react within seconds. Failure to do so might lead to loss of lives or at least to substantial costs, not being able to run our operations. And how Secapp responds to that is that what I mentioned, it's a critical communications platform with a special focus on alerting and capturing your attention when needed. It allows to send and respond to alerts in a matter of seconds, whether there's a small group of nurses, doctors, management, or even the whole organization. In addition, it provides a platform to exchange information through chats, videos, and checklists in a secured environment. It integrates the other systems for automated alerting, for instance, and it provides a platform that works with any device. It provides a platform for combining all of the communication technologies under one platform, and it can even bypass silent settings at the end users' devices, making sure that the alerts are noticed and responded within seconds. Taking Secapp into use is very straightforward and easy. You can do that even today, which is important to people that you want to communicate with there, and we keep an online training for you and you're set to go. The pricing is very modest. It's based on the user volumes, as well as there are, of course, options to use your dedicated environment instead of our SaaS service. But with the SaaS service, you can start right away. Thank you for your time, and feel free to contact me for any additional questions, comments, or something like that. As I said, we are Secapp and ready to help you to save lives. Thank you.
Spot on, Kari. Time control. I'm switching then over to Andrew Watson from VAR Healthcare. Yeah, please start when you're ready.
Okay, great. Paul, can you see my screen?
Yes, we can.
Perfect. So my name is Andrew Watson. I'm the International Sales Manager for VAR Healthcare, and we have a clinical decision support tool for nursing, education, and practice. Research has shown, and our 20 years experience has confirmed, that there are a number of challenges to healthcare agencies, and there's a number of serious consequences. What are those? Local procedures vary significantly. There's an inability to be able to keep up with research and best practice development. This leads to discontinuity of care, as well as inconsistency in treatment. And finally, because of insufficient documentation, there's a lack of interoperability. There's a lack of comprehensive decision support. With regard to the serious consequences, the most important probably is poor patient outcomes, but equally there's an ineffective use of the institution's time and resources. There's an atmosphere of uncertainty and lack of trust, which is fostered, and this is not only between the patient and the caregiver, but also between colleagues, and that leads to poor communication. And finally, there's discrepancy, mistakes, and decreased patient safety. So our solution is technology and content that best supports clinical practice in being able to make rapid and qualified decisions for better documentation and better patient outcomes, and all of this based upon evidence and up-to-date procedures, knowledge, and tests. VAR Healthcare is a solution for lifelong learning. At VAR Healthcare, we make evidence usable. We're a pioneer in the use of evidence-based practice, and we have a proven track record of innovation and implementation over the last 20 years. We have well-documented quantitative and qualitative return on investment, and our clinical decision support system is ready to use as it is, extremely user-friendly with a responsive design for PCs, for tablets, and for cell phones. It's a web-based program, but there's free private use for your staff. We're ready for integration within electronic patient records, within health, within blended learning, or also within the quality management systems. And we also have extra modules, for example, the local procedures in our system, and able to access those as well. We also have an eye on the future. So the customization of existing training tools, a strong focus on interactive learning material, We have a model of practical skill performance that is allowed to evaluate how well and how evidence-based the procedures are actually done. We also have a VAR case that we're working on, and that's the ability to solve practical cases with integrations into VAR for support, as well as for the international classification of nursing practices. We're also looking at additional modules and development specifically to better visualize VAR's evidence-based content, for example, with VR gamification and additional other interactive learning tools.
Thank you.
For you, then please reach out and contact me or our director, Dr. Ann-Christine Rotegaard, and I encourage you to have a look at our video VAR in 2 minutes. Thank you very much.
Thank you so much, Andrew. We are then moving into the final presentation for today, and it's going to be Sebastian from ZignSec. Sebastian, take it away.
Thank you, Paul. Good afternoon, ladies and gentlemen. My name is Sebastian. I'm the Vice President Asia of ZignSec, based in Singapore. ZignSec is a Nasdaq Nordic listed company founded in Sweden 2015, with the vision to automate the process for companies to identify their customers digitally in real time. While COVID-19 has crippled many companies in the world, it has leapfrogged the need for digitalization of multiple industries and sectors, such as healthcare. So what does digitalization in healthcare means for resident patients as well as medical tourists in today's world? It means access to medical records, education, consultation with doctors from the comfort of our home. In order for such digitalization to be implemented so that patients feel safe and secure, is to make sure their data and access to data is authenticated and verified. ZignSec is a global identity service platform for both regulated businesses and non-regulated businesses, such as digital health sector. We offer one global platform that enables digital health companies to combine multiple identity methods for onboarding patients. Focusing in on health sector, through our interoperability identification services, patients can safely and securely conduct online consultations, such as telemedicine, access their prescriptions and medical records throughout over 200 plus countries. How do we verify the identity of those patients across those 200 countries? Our solution allows for a waterfall implementation, whereby the most used identification method in a particular country is offered to the patient. In the healthcare sector, this is specifically important for medical tourists who can be identified in advance and offered possibility to access prescriptions and consultations from their home country when they fly back. These services and solutions can be implemented via an on and off configuration, switch through one single integration, and we have 3 different ways for digital solutions to integrate to our platform. One is a web SDK that can be rebranded, does not require any programming skills, a REST API, and a mobile SDK, which is available for iOS and Android. As an example, in the health sector, we implemented our solution with Unilabs, a European diagnostic company, for the Norwegian and Swedish expansion, focusing in on digitalization, specifically on their imaging diagnostic services. But they had some challenges, such as how do we safely share sensitive information online. Our solution provided them with identity authentication and verification of individuals accessing their digital platform for records, X-rays, MRAs, consultation, and booking of meetings. Due to the implementation, their business was heavily impacted, such as over 50% reduction in operational steps, 10 times faster in providing diagnostic, and today they do, in Norway alone, over 300,000 authentications per year. Thank you very much for listening.
Thank you very much, Sebastian. All right, so essentially, there is an opportunity to obviously reach out to us or to the companies in case there are any questions to these presentations. I haven't picked up on any questions so far in the chat or the Q&A. So I would urge those that are listening to either post them now, or also you could obviously follow up with us following this session at a later stage, that is also quite okay. So I think unless there are any questions, we might choose to conclude, but maybe we'll give it 30 seconds to see if there are any specific questions from the attendees. Maybe one of the companies or presenters have a specific questions that they would like to ask. All right. Well, then I think we can conclude the session for now, and I will urge everyone to obviously get back to us at a later stage when they've had some time to digest the information. There is more information on the Nordic Innovation House website as well, on the various participating companies with information about their solutions and so on. And then you can, of course, reach out to me or some of our colleagues and partners at the Nordic Innovation House at the later stage. And I'll also like to extend a special thanks to all the participating companies from the Nordics for giving us an introduction to the solutions that you provide. And I'll catch up with all of you at a later stage. So, guys, thanks a lot, and also wish you a very good weekend.
Thanks, Paul.
Thank you, and likewise.
Thank
Thank you very much.
Well,